instructor working to improve how healthcare providers have difficult conversation. She lives in the beautiful state of Utah with her family and 2 Pomeranians, one of which is a therapy dog for children at the hospital. And I think they're just outside her office door there. So with that, I will turn it over to Jamie.
Awesome. Thank you so much, Candy. As she mentioned, I was going to apologize ahead of time for my voice, and we'll hope for the best here as we go through. I do want to just, say, I think as with really most of our sessions here, I would love interaction. Please feel free to kind of break in and ask questions, or go ahead and put it in the chat if you have questions that come up. If it's something I'm going to delve into a little bit later, I will try to mention that and make sure that we address all of your questions as we're going through. I think, kind of fairly quickly go through some of this, because I think fortunately, for those camps that did have an in-person camp this year, a lot of our processes were the same. We shared information, didn't try to reinvent the wheel, but we will kind of talk in depth on the topics that interest you the most. Please feel free to interrupt as you wish. So I have no disclosures to reveal at this point, and here are the objectives for the talk today, which we will hopefully discuss the process of creating a safe environment for our kiddos in this time of the pandemic, and share the policies and procedures that we developed during the COVID pandemic and what lessons we learned in that process, because there certainly were a few things that we learned, looking back on things. So as Candy mentioned, I'm a nurse practitioner currently in palliative care and neonatology at Primary Children's Hospital. And I've been with Camp Hobie for a long time. I love oncology camping. I love Camp Hobie. I love COCA and everything that we all stand for and do. And there is a picture of one of my cute girls from camp and my little therapy dog, Roxy, the Pomeranians. Couple of things about the camp that we held this summer, just so you have a basis of comparison for what camp you're looking at to move forward into. We do provide camp for patients and their siblings during treatment and up to 3 years after. We have several different types of sessions, including a day camp, a Hobie Juniors, which is a 1-night over camp for littles, and Kids Week, a teen week, and then also a virtual option, which was really prompted by last year's experience. We have other activities for our families throughout the year as well, which we've been trying to continue to participate in as is safe and as we've been able to do. And those are things like a hockey night or something we call Cookies and Cocoa, where we have families drive up and pick up cocoa and cookies from us at a local store. We have a family barbecue night where another local store provides dinner for our families. So a variety of different activities throughout the year. Our actual camp sessions are consolidated in a 2.5-3 week period during the month of June. So camp planning for 2021, and we started talking about, are we going to do this year? Can we do it this year? What is that going to look like? And I thought the best place to start was in December to January of 2020, early 2021. I decided to reach out to the experts, our infectious disease providers, and some infection control people at our local institutions. And I got some information back from them that was very, very useful and very guiding, but also really prompted this feeling and also prompted the name of this particular talk today. The initial response was, I think you're going to be a little better off doing a less controversial or less challenging subject like climate change versus trying to have an immunosuppressed camp in the middle of a pandemic. And I can certainly understand, looking at the time frame of where we were at and trying to, see if we were going to get vaccinations out and how quickly were we going to get it out to the public, and everything that our infectious disease colleagues have lived through in the past now 2 years. Certainly could see why they had the reaction they did, but this is how I felt. And I think last night during our medical roundtable, it was, I brought up the fact that this was not an easy decision for us, and it certainly was a lot of work, but it was doable, and we were able to accomplish having camp. So just knowing that if you feel like this initially, it's okay. You're gonna get through it and work through the process, and hopefully those camps that did have in-person camp this year are all willing to help you out. We're definitely willing to help you out. So after asking the experts, the next thing we really wanted to do was ask the stakeholders. Okay, so we are considering taking on this really what feels like a very monumental task, but are the people even interested that matter in this whole thing? And so looked at who our stakeholders were for this and decided to reach out to them and just ask them. So we asked our families, and they obviously asked the campers. We asked oncologists. I did that really one-on-one, just individually talking to each of our oncologists. And we also were able to present some information to the department as a whole about camp as a whole, what it looks like, and then also our individual plans for proceeding forward in the midst of COVID-19. And then we asked our staff and volunteers, were they interested? Was this even something that they could or would be willing to participate in? And I will say universally, the answer was yes, we would love for this to be in person. And obviously, everybody had some hesitation, especially the oncologists, not knowing, because we do ask them to sign off on our patients saying that they are safe and able to come to camp. And if they don't do that, then the patients cannot come to camp. So they were a little nervous about this, appropriately so, as were a lot of the other stakeholders involved, about whether or not they felt like it was something safe, but they did want to try it. Our families very much wanted to have their children back in the community of camp and being a part of that, and just wanted to, find a safe way to do so. So once we got the information that people were in fact interested and that our community felt like it was a responsible and respectful thing to do, because we also didn't want to send the message that we didn't recognize that we were in a pandemic. We wanted to let people know that we wanted to be respectful about that and not do anything that would put anybody, our staff, campers, anyone at risk, or minimize what everyone was currently going through. Once we got that message out, made sure the families and other stakeholders felt supported, we proceeded forward with creating a COVID-19 leadership team. That leadership team included myself as the medical director, Chris Beckwith, our executive director, and Ashley Klinger, our deputy director. And we really just came together and started talking about what was this going to look like and what did we need to do to create this policy and then subsequently implement the policy. So in defining or in developing our policies and procedures, we really started by defining the goals. And we saw those as a safety and risk mitigation. We had to come from the perspective of COVID was going to enter camp. So how were we going to mitigate that risk? And then once it did enter camp, how would we mitigate the spread? Our hope and our dream was always that we would be able to have no COVID enter into camp. But it just didn't seem, it seemed almost too good to be true, like too much of a dream to reach for. But how could we mitigate every risk at every step of the way that we could and really kind of implement that Swiss cheese effect in protecting our kids and our staff and our volunteers? We also felt that one of the goals was to have fun. We go through all of this work and then nobody has fun and it's just stressful. Then really what was the point of this when we know that we can have an amazing virtual experience and keep everyone safe? Then the feasibility, or the things that we're going to be asking people and ourselves to do. Is it even feasible? Can camp afford to do what we need to do? And finally, is it necessary? And I think, I've heard throughout the sessions at COCA this week that I think we all see the necessity, and the necessity, especially after, almost 2 years, year and a half, 2 years of being isolated from each other. And especially during those really crucial years of development that all of our campers are at, I think we all can see that the necessity is important, and that the bonding, the interaction, the learning that you obtain from an in-person camp is necessary. And so we felt like all of these goals could be met, that they were feasible, and that we wanted to move forward. We did have a planning committee town hall, and what that looked like was a Zoom meeting with all of our planning committee, our program directors, executive director, medical director, all of us gathered together. And we just talked about what people were worried about, what they could see and what problems they could see coming up, and help, get some ideas for problem solving, and just a kind of a big picture meeting to see if our planning committee felt like they could do that. We created a COVID, what we just called a go, no go document, which I'll show you in a little bit, and then ultimately our policy development. So as I mentioned, this planning committee town hall happened. I think we all know that we need staff buy-in for everything that we do. If our staff and volunteers are not in agreement with what we're doing, we're never going to get off the ground. That is from everything from field games, if your counselors are sitting on the sidelines, to where your campers. We saw it the same way with this COVID policy implementation, that if our staff were not involved, that all of the requirements that we were going to have to do to keep people safe medically, we're never going to get off the ground. And so this is really what the agenda was for this town hall, was to help them get buy-in, make sure that they felt a participant in the planning and respected in the whole process. And it was a very open forum, and really also started what I believe is a culture of kindness and safety surrounding this entire topic. And that worked out for us in the long term in a lot of ways. But what that really looked like for us was this topic was about keeping everyone safe. You could not be asking people their individual views or immunization status or any of that. It was really this big picture that I might be asking people to do really kind of over, above, and beyond what the current medical recommendations were. But that is because we have a unique population that is immunosuppressed and that we couldn't take the risk of harming anyone and further promoting or being a hotspot for COVID-19. And so the people that knew about immunization status were the COVID committee. So the executive director, medical director, and deputy director, and then medical providers. If you came into the Med Shack during the week, then yes, they may notice your immunization status, but it wasn't something we were constantly discussing. And I just really wanted people to know that camp was not a place to have those continued feelings that were out in the community of angst and anger, but a place of acceptance and kindness, and that we would ultimately trust each other to do the best for each other and for our campers, and that we didn't need to have extensive conversations with each other about opinions, but really that we were going to set down the rules and follow the rules in order to keep everyone safe. And very quickly, everybody got on board with that. So the go, no-go criteria for us was just a simple brain dump. That's what it was. We put everything onto paper that we thought we absolutely needed. We took some of it from our infectious disease experts and what they had given us, and put our own twist on that, and then really narrowed down. I say specific, but it was specifically vague, as you will see here in a minute. And this was our initial document. So before we created a policy, we just needed to have a general, like, how do we know we're going to do this or we're not going to do this? And what does that look like? And you can see through here that we mentioned that we want to meet safety requirements, which include testing, monitoring, social distancing, and mask wearing, but we didn't go into the specifics of what that looked like yet. We just knew that was something we had to touch on. We set dates so that we knew when do we have to know that we have staff, the volunteers, the providers in place, and the campers in place to be able to have camp and have it done safely. And so we had these things lined out. This was our step one of trying to piece together what it was going to look like for us to go forward with camp or to cancel in-person camp for 2021. We set goals for immunity versus just immunization. So define what those are in number 3. And then also rolling seven-day average case counts and just local restrictions. We did clarify reasons why we would absolutely cancel camp if we needed to keep people safe. All right. And then as far as the Camp Hobie policy that we created, this is our COVID-19 operational strategy. Should, and Chris can laugh at this a little bit, my link right there at the top, COVID operational policy should work, you guys. And we will look at this towards the end. I just don't want to kind of interfere with anything here. I'll show you an image of it. You should on your, when you download my PowerPoint, you should be able to use that link. If that does not work, please just reach out to Camp Hobie, to myself, to Chris Beckwith, and we can get you a copy of our policy. It's a 6-page document that goes into a lot of detail about our strategy for managing this. But I have a lot of a challenge with the links working in my document, so I wouldn't be surprised if it doesn't work. This was really a supplement to our current healthcare policy and our emergency management policies, which are already in place thanks to COCA-I, the gold ribbon. We already have a lot of those in place and operational. And I wanted to make people understand that these were minimum recommendations that we oftentimes were going far above and beyond, but that we were following the guidelines set forth by the CDC, the ACA Field Guide, COCA-I, ACN, Utah Department of Health, and the local hospital system guidelines that we were using. So that while those organizations might all say, you have to do this, we may be asking as a camp team to kind of go above that level because of the population we were serving. And as I'll talk about a little bit later, because of the numbers in our community and kind of the risk that I felt like we were taking. All right, so my first question was to begin or not to begin. So how do we know that we're even gonna start this process? And these were the things we felt like we needed to address. We needed to know we had adequate staffing and what that looked like, what those numbers like. That involved things like looking at the bed spacing. Could we keep people 6 feet apart? Could we ensure that we had enough medical staff? All of those things needed to be in place first. And so even before we committed to going live for sure, we were still doing all of our staffing procedures. We wanted adequate immunity, which for us was greater than 80%. We were looking for greater than 80% vaccination. And if you had a COVID infection in the last 90 days that was documented, that we had documented proof of, then that fell into our immunity category. If you had exceptions for medical or religious reasons, or just chose not to get the vaccination and had not had a recent infection, then that all fell into the non-immune category. There was no kind of gray ground at all. It was either immune or non-immune, and we had to hit at least 80% to be able to proceed forward with camp. And we had to stay at 80%. So once we hit it, we had to stay there through the entire session of camp. So if people quit that were immune and that threw that balance off, that would mean that we would not be able to have in-person camp. We had to have an acceptable rolling. We did 7-day average by test report date because that was the most kind of consistent and reliable way to know that we knew where our numbers were at in the community and kind of where our risk was at. Our infectious disease doctor felt that the goal should be less than 200 cases on that 7-day rolling average. Per day. We decided to shoot for a 250 to 300 because at the time that we were actually making this policy, we were right around 2,000 cases a day. And we also knew that we needed some space in there to have some fluctuations and not be just one solid number because it would be such a hard number to really hit and track. But we felt like 250 to 300 was reasonable. And part of that, and it had to be stable or dropping. If it was continuing to increase, that would be another reason that we would not be able to proceed forward. The other reason for this is that in some of the areas that our families were coming from, because we cover a 5-state area, and we had campers this year from most of those states, some of those areas were much, much lower. Some of them were much, much higher. And so we were really going by the major counties, the overall state numbers. But we also know that our camper families are very used to being particularly cautious, that even if our community levels were 200, 300 or more, that we could have some wiggle room because of how our patients and their families operate on a day-to-day basis, regardless of COVID or not, and the safety and the extra safety steps that they often take to prevent communicable diseases. Our acceptable person-to-person 7-day average, this will probably startle those of you that know what it is, actually accepted 10% stable and dropping. So anything less than that, we would consider an acceptable rate of transmission in the community. And for those of you that may not be familiar with the person-to-person 7-day average of percent positivity, that really tells you the spread of it within the community. The higher the number, and usually the cutoff for most infectious disease people are 5%. Ours never in Utah, I still don't think it has hit less than 5%, is often 15 to 20%. And so we feel like 10% or less would be a reasonable goal to shoot for that would tell us that it was quite heavy in the community, but as long as it was dropping and less than 10%, we felt it was a reasonable risk to take. Do I need to pause for any questions at this point?
There are a few questions in the chat. One I think you answered, but I'll say it again, was what was the geographic area for your target case rates, state or county?
So statewide, we followed the county we were in where the camp was actually being held, but because of the widespread nature of our kids, yeah, we did this statewide.
And then Winnie asked, so the non-immune campers and counselors included counselors with medical or religious exemptions, ?
Yes, yeah, we did that this year because we knew that we felt like that it was such a risk to be taking in the midst of a pandemic that we really had to know that we had kind of that 80% buffer. Our campers were not included in that because most of our campers, you can't do immunizations at this point anyway because they're patients. And they were, in this particular case, obviously too young to even get the immunization. So we really did focus on our staff and volunteers that came in. Okay. And then how do we decide that we're going to continue versus not continue? So this was really an extension of those numbers that you saw before. So if we saw an increase in community transmission, increasing variants that were concerning, or an increased positivity rate, those would be reasons that we would need to halt in-person camp and transition back to straight virtual. If we had more than 3 COVID cases identified during the camp session, not, obviously if we caught them at the door before they got in, was a separate entity. But if 3 cases popped up during a week-long session, that would we would pause at that point, evaluate if we had contained with our cohorting, and then likely not be able to proceed with camp. We would obviously evaluate it, and then there would be not just that day come down, but quickly evaluate and see what the safety risk was. And then obviously state or local orders to cease in-person operations. And then any reason that the COVID-19 leadership just felt that it was unsafe and that we needed to stop the camp. Okay, we did ask our staff, volunteers, and campers, their families, to do some pre-camp risk reduction. And we felt for a lot of our families, this was not a huge change in their practice, but for a lot of our staff and campers, it might be. So we started with our vaccination and immunity goals, which we've talked about. So greater than 80% of the staff and volunteers needing to be immune. Which for us, immunity was completion of the vaccination series greater than 2 weeks before the start of the camp session, or COVID-19 positive test in the past 90 days, but no longer contagious or symptomatic. We did not include campers, as I mentioned, at this time.
Jamie, can I hop in really fast? We also didn't count if somebody had a medical exemption for vaccination. We didn't count them towards that 80% total.
We did actually end up counting them, though. Originally, we'd said we would not, but when we did, we ended up still well above our 80% mark. The other at-home practices that we asked people to do was just avoid international travel and really travel as much as possible, or any areas that were deemed high risk by the CDC, which at this point is most places. We asked them to limit exposure to large groups and infected individuals, to wear a face mask in public and around other individuals if they were being exposed to larger groups, because at that point in Utah, face masks were no longer required. And so most people were not wearing them. And then to continue their social distancing practices and to be really thoughtful about the fact that they were coming to this camp and that we wanted them to be exceptionally careful. Probably one of the bigger workload things that we took on was the testing. And what our testing looked like was, after much debate, was for campers, we had all of them do a PCR test. Depending on their location, we would help them kind of figure out which of these they could do. Somewhere between 48 hours, actually up to 10 days pre-arrival to camp, they had to have a PCR done and negative. And the reason for that is, again, to the spread of the area that we were trying to cover. So many places were rural, and trying to get a test done and reported in under 10 days was near impossible in some of those locations. And so we had to really give a widespread. For those that were in more urban locations or near places that I knew that we had rapid PCRs or rapid responses to the PCRs that were being done, then they could have them as close as 48 hours. And I was much happier with those, because they were obviously more valuable the closer that you actually get to camp. We did also encourage people after, if they had a test, once they had a test, we kind of really amp up those cautious behaviors ahead of time. And then once the campers arrived, we tested them all on site. And so the Utah Department of Health came out and did all of the testing. And so we did that right upon their arrival to campsite. So we had that immediately upon arrival. Then staff, volunteers, and visitors, same thing, except that we did not do their rapid antigen testing. We asked that they get the PCR less than 10 days prior to arrival, and the rapid antigen less than 24 hours upon arrival to the campsite. And I will tell you that what changed right kind of that week of camp is that if you were fully vaccinated and you were in an urban area that could get a result within 24 hours to 48 hours PCR, you could just do the PCR test within the 24 to 48 hours before camp. Then you'd have to restrict any exposure that you had after that. So that was the secondary exception that we allowed once we got close enough to camp and realized that we had the availability to still do that testing. And then ultimately we arranged, if the Utah Department of Health did free screening for all of our camp, all of our participants, actually, staff, volunteers, and campers, which I can talk about. I'll talk about a little bit later about where that ended up going. And then for those that were outside of an area that actually didn't offer testing that would get them in the timely manner that we needed, then we did arrange for an organization to send them out a testing kit that in the mail that camp would pay for. We didn't actually end up having anybody use that particular system. We had one volunteer who did, but chose to pay for it herself. But we did offer, camp offered to pay for all of those.
There is, Jamie, a question in the chat about testing.
Yeah.
What about campers or counselors who tested positive on PCR in the last 90 days, who we know will test positive for many weeks after their initial infection?
Those people I did not actually have tests. Some of them did anyway. And I was actually surprised that a few of them still came back negative, but I did ask them not to get tested, and that, we would just, they had to absolutely be vigilant with reporting symptoms. If any of their symptoms came back, then I would want them to consider not coming, because we do know that often the testing is positive for many weeks after. So we didn't test those, and there were, I think, 4 or 5 of those people, and they were all well and actually did not run into any problems with that. So yeah, thank you. All right, planning and training. So this was no small feat, and I just wanted to take a minute. I won't spend a lot of time here because we'll talk some more about it, but it really took superheroes on my team's part to get this done. Our program directors and the work that they had to do to make a schedule that fit everything that we ended up requesting as a COVID team was a lot, and it took a lot of work, and I just couldn't be more grateful. And one of the things that we did during the town halls were really wanting to make people understand that this was going to be a lot of work, and that we knew that, but we appreciated the commitment they had to camp, and it did work out. But it was just incredible, the amount of work that they had to put in there. We also really tried to lead by example and changed everything, training, interviews, everything was virtual ahead of time, because we wanted to lead by example and really restrict the exposure that people had leading up to camp. We also did cancel one in-person kind of family event that we had been planning, because it was still such an incredibly high transmission in the community at that point. We did do also a virtual town hall for families. Staff and volunteer were invited, but it really was for our families to be able to come and ask their last minute worries and questions before camp. It was a few weeks, Chris, I think it was 2 or 3 weeks before camp, maybe a month. But they were able to come in, we told them what the plan was, what our expectations were, what was going to need to be required by their campers to be able to come, and what our staff was doing to keep their campers safe. And it was very well received, very well attended. And I think alleviated a lot of worry for some of our families that maybe are a little more anxious about sending their kids during a pandemic to an in-person camp. All right, and then we finally made it. So months of work, months of planning, because I'll show you the policy here in a minute, that 6-page document that we created. But we did finally make it to camp with, I think universally, I haven't heard of a camp that has gone in person that hasn't loved this edition. So for those of you that haven't experienced it yet, it would be the drive-through, check in and check out of camp. This particular picture is actually one of our families and our Utah Department of Health doing their antigen test right in the car. They would just, you can't tell, he's got a gown on the front, mask, goggles, all of that, would reach in, swab, test. And then by the time they finished their check-in, they had their results and were able to then get out of the car, join their cabin, parents drove away. And it was just remarkable at the efficiency. I was worried from a medical standpoint, like some of these kids have just boxes of meds, and how are we going to do the check-in safely? And it was actually safer than I think we've ever had, because it was so quiet, because everybody was so far spaced. Everybody was contained in a car. So people weren't running around. It wasn't this loud kind of environment that we were in. And we had tables set up and checklists and checkboards, and we were able to check their temperatures, and it all worked out really, really well and was highly efficient. And kids, the separation from parent was much less dramatic and emotional for these kids, and just a lot more fun. So pretty exciting, and definitely a piece of this whole thing that I hope we are able to keep forever, because it really made such a big difference. And I just, a shout out to the Utah Department of Health here too. They showed up and had fun and made the COVID testing much less traumatic, and a lot of fun for these kids, instead of, another task and something scary to have to worry about. So we were able to do that and get the results before they got out of the car. So we were able to keep everybody really safe that way. The other MPIs that we included, so the non-pharmaceutical interventions, are listed here, and I'll just kind of talk a little bit about each of these. So we did cohorting, which I think was pretty universal among the camps that were successful here as well. We had cabin groups, which were a group of 8 people, counselors and campers, which did require a reduction in our overall camper numbers. And then we had activity pods and then staff and visitor cohorts. So the cabin groups were people who showered, ate, brushed teeth, did all of kind of the activities immediately together and could be without masks with each other. The activity pods were 2 cabin groups. Some of them were 3 cabin groups put together. We tried to keep them at 2, so 16 people total. And those people would do all of their rotations together, their activity rotations, but we kept masks on all of the time, except for those activities where you were only in your cabin group, which truly was just swimming, eating, showering, and sleeping. The rest of the time we had masks on. And I thought this was going to be really, really hard because, as I mentioned a few marks down, face masks being required in greater than 100-degree weather, I thought was going to be a challenge. And especially with the littler kids where I can't really explain to them why we're doing this. And remarkably, it wasn't. So we were able to keep those masks on, had really no major problems that I can think of at all doing so. And that really allowed us to be able to know if we have a positive test at camp or some sort of exposure that happens, we know who those people rotated with all of the time. And so our contact tracing, which would be done by the Utah Department of Health, is going to be very relatively easy because we didn't kind of cross-expose people. And then the staff cohorts, same thing. If you were in just your staff or just your visitor cohort, because we did have 2 visitor groups come in, then those were the only people that you could be around without a mask. If you were around other people, you had to have your mask on. We did do health check-ins daily in kind of a variety of ways. So one of the things we got, and I can share the link, they were amazing. We had 2 stands that had a thermometer on it and a hand sanitizer. You got your hand sanitizer. While you did that, it checked your temperature, would set off an alarm if it was very high or very low. So all of our nurses, what they had to do for that was just stand by and just make sure that they were appropriate distance and had their hat off and hair, that sort of thing. So it was very hands off. It was very, very rapid. It didn't slow anything down because, really by the time you were done rubbing your hand sanitizer in, it was done and you could move on and it was reset for the next person. So that didn't slow down any of our process, but allowed us to have that moment of checking the temperatures. I did choose, because of how very hot it was the entire time of camp, for us to do that at breakfast only, because most of our kids, would be out in the sun, and a temperature like that is going to come back artificially high, and then have to wait 15 minutes and check it again. And so I felt like the breakfast temperature would be the most reliable. We also asked every morning, just as a reminder, to please come by the med shack if you or any of your campers had any symptoms. So it wasn't a hugely labor intensive thing, but it was a constant reminder just to be really vigilant, which I think our counselors have historically been amazing about reporting any symptoms to us. And so I don't think this was a huge change in that, except maybe they were slightly more vigilant than usual. But because of the patients that we have as campers, I don't think this was a huge change. Hand sanitizing and washing. To be honest with you, I don't think this changed much, other than our campsite that we rent from did install a bunch of hand sanitizer dispensers throughout. We bought a few extras. So we had them just everywhere at camp. So it was much easier that way versus having to buy a bunch of bottles and spread them throughout camp. They were just already there. So it was much easier and we were much more aware of it. But that is, I think, something that we have always put an emphasis on and will continue to do so in the future. Face masks, I mentioned, were all the time, and it really wasn't a problem. We did have, I'll show you, at our cute little, was Safari year. So we had our little logo put on our masks, and everybody got at least one of these. And then we asked families to bring 2 masks per camper per day. And then if they were dirty or wet, they just had to be changed out. We also bought and had many donated to us so that we had a lot of additional supply to be able to make sure that people always had clean, fresh masks available. Some of the cross-exposure things that we had to think about were shower time. We have our biffy, which is got a bunch of showers, a bunch of sinks in it. And usually it is just crammed full of people morning and night. But we alternated. That shower was actually put on the schedule as an activity that you did. And so there was only one cabin at a time. It was just one cabin at a time in there showering, brushing teeth. We actually got jugs of water and set them at each of the cabins, and they brushed their teeth out in the wilderness, away from people. And so we didn't have that happening in the Biffy as well. So we changed that up, as well as our sleeping and bucking standards. So by decreasing our number of overall campers, we were able to strategically place them, and we mapped it out ahead of time. That's partially how we decided how many campers we could have, so that we were all head to toe. He was head to head, and everybody was 6 feet away. Their faces were 6 feet away from other people. And so we did really try very carefully to do that. We also ended up hanging up sheets around the bunks, just, tacking them into the wood, so that they were little caves, and we made it fun, but it was also a barrier at night when people were sleeping. And we requested that people leave there. We have 2 windows on either side of the cabins. Just leave those open at night. We have cross flow, airflow that way. We have heaters or fans if it's hot or cold. And so we were able to keep airflow moving in cabins that typically don't have much air circulation at all. And I mentioned we rent our facilities, and so we had no control over increasing the airflow in the actual cabin structurally, but we could do it in a variety of other ways. So being creative and trying to think of how to minimize exposure to people, I think you can really come up with a lot of different answers. One of the most popular things that we did, and I hope we can figure out ways to do it, was outdoor dining. All our activities, all of our eating was done outside under a giant tent. It did do some damage to the grass, so we got to rethink how we're going to do that in the future. But people loved it. People loved being outside. It was much less hard on your ears when they were doing the cheering and chanting, but just as fun. And it was just beautiful to be out in the outdoors and to be able to see the place that we were in. It was a great addition, I think. And really one of the highest risk things that we do is eating during a pandemic with other groups. And so being able to really open that up, spread people out, make sure people were in their cabin groups instead of right on top of each other, really helped protect everyone from kind of sharing germs that way. The high touch surface cleaning is another thing that, I don't think is any different than what we've done in the past or before. Initially there was a lot of concern that COVID was being spread on surfaces. And fortunately, before our camp actually rolled around, a lot of information came out saying that was actually not the truth, and that standard cleaning to prevent infection control was adequate. So we do have a very, defined in our policy of what that cleaning looked like. But it wasn't as intensive. I originally thought we would have to have like a cleaning crew and all of these additional things added in. And we were fortunate to not have to do really much different than what we did before. Some differences, but not a ton. And then ultimately, everybody was very clear about what these things were. And so if they did not follow, they got one warning. There was a disciplinary plan, and you would be asked to leave camp if you were unable to follow these requests. So our MedShack specifics that we had to do a little bit differently. A lot of it was really welcome changes, and I don't think anything that was excessive, but we did make sure that we had people that were fit tested at 95 that could do the testing should we have some sort of breakout that we knew for sure had the right N95s there at camp. We provided goggles, gowns, gloves, and surgical masks to everybody. We have I know it's their large room outside of our mid-pass area, and it usually is kind of this chaotic, fun place to be. But we moved that all to outside. So people had to wait on the porch. We would call in 1 or 2 campers at a time, however many that we could keep separated, bring them in, do their medication pass, and move on. It didn't slow anything down. I thought it would. I think, to be honest, I think it increased safety because we were so focused on the 1, 2, maybe 3 campers that were in the room at a time, and it was so much quieter that it was really a really safe way to do our med pass and able to do our double checks and everything else and be able to hear each other and know who was assigned to which of those kids. So I think that was an overall improvement that, again, is weather allowing, we will continue to do. We also put in a place in that very large room that was a separate COVID testing and resting area. So if somebody came in with symptoms that could even be questionable for COVID, there was a separate area that was walled off where they would rest and where we could perform the testing that people couldn't see. The other thing to think about is if you want to do testing on site, like we did want to do, because we're far, we're close to a hospital, but far enough out, wanted to have control over being able to quickly do some antigen tests and know how to move forward with our kids if we have any symptoms that popped up at camp. You do need to apply for a CLIA waiver, and then also, get the state applications done to get the testing done. And for our particular state, we were very fortunate. All of that went very, very quickly, got the CLIA waiver quickly. And the state also provided all of our antigen testing for free. So that took us some hunting and looking, but we did finally connect with the same group that does the testing for our schools locally, did want to support any sort of environment where kids were coming together in groups. And so camp did fall underneath that. And we were able to get those tests that way, which falls into the next question, which I actually just added on here after last night's question of how, during the medical roundtable, like how did we afford, what was our budget? How did we obtain supplies? And Chris might be able to, if you have specific questions, tell you the exact budget, because I can't remember now what the numbers were, but I know she does. But really, we ended up getting a ton of hand sanitizer donated, and the campsite that we went from bought. We ended up getting a lot of KN95s and surgical masks donated. We had just a lot of things that ended up being donated. And then the rest we got through Amazon Business or some other organizations that do kind of larger bulk orders to get our cleaning supplies if we wanted something different than what our camp did for us. But I was really pleasantly surprised, and especially if you ask at the end of school year, if you have the ability to do this, if a school's going to be shutting down for the summer and some of that stuff's going to expire, or they're worried about storing it or whatever, you may be able to get some very large donations to cover some of these costs so that everything isn't coming out of your camp's budget.
Jamie, there was one question that says, what supplier did you use to get hospital grade N95s and gowns, which I think you answered, but I just wanted to make sure you saw that question.
So I actually used the hospital that I work with, so Primary Children's Hospital. I talked to their oncology department, and they provided us with the few little items that we needed that were hospital grade. A lot of just the regular gowns that we used, the paper gowns, those came off of Amazon. The KN95s were donated to us. And I'm trying to remember what else, but really the organization that I work with.
I think that was it. We bought, like you ordered, we had ordered a couple of other thermometer things that you found online, but I think most of it was Amazon. A couple we might have gotten at random places before we really got deep into planning.
Yeah. And I got the temperature hand sanitizer combo off of Amazon, and they were remarkable for the price that we got them at. Because when I originally looked at the medical grade ones, they were anywhere from $2,000 to $5,000 a piece. And these were about $300 a piece. So we found some really great deals. If you need that information, please just email me. I'm happy to give you the locations and names of what I ended up getting that worked well. And if there was anything that didn't work well, I don't recall having any trouble with anything, but there were specific things that I ordered that we had used at the hospital. So I knew that had already worked well. So that was what I went out searching for. So as far as potential exposure and contact tracing, I touched on this a little bit, but I really just, brought them into that isolation area of the med shack and separated them out quietly, discreetly, and did the on-site testing. If that antigen came back positive, we had the state who would support us in getting a confirmation of that positive test with a rapid PCR. And then they would come in and help us do the contact tracing, starting with testing all of the people in their particular cohort, which is why I think cohorts were hugely important this year, and I suspect next year. The other things that we did to kind of minimize this exposure was that we asked that our staff not leave the campsite. And if we did, for example, if somebody was there for the full 3 or 4 sessions, then they might need to leave for a few days and come back. And we just asked that they obtain a rapid PCR before returning. And, or if it was a shorter time than that, then we would have them do an antigen and just not be exposed to anybody. We really just pleaded the case that we needed to keep everyone safe, and people did that. And so we were able to really minimize the number of people that came and went off of the actual campsite. We also really restricted our visitors. A lot of times we have different groups come in and perform and whatever else. And we tried to limit that as much as we could this year. On those that we did not, had to follow the same rules as everyone else. So minimize exposure ahead of time, have the testing done, show me the testing before you came onto site, and then wear masks and stay in your visitor cohort away from the kids instead of interacting kind of as closely as they often do with our campers, just really being thoughtful about their exposure risk. And then after camp, I actually reached out to all of our families and all of our staff to determine if we had any symptoms of any infectious illness going around. If they had any symptoms at all, I did ask them to go get COVID tested, which they did. And that was kind of the way that we tracked it once they got home as far as what our exposure was, in addition to our camp testing. And then I get home and the first thing that Chris sends me is this. So welcome home. You get through all of this. You think you finally relaxed. And then the camps that were happening at the same time as us ended up having breakout after breakout after breakout. And it was terrifying. So those couple of weeks after camp, because we did track for 14 days after the end of each session, tracked for symptoms, tracked for positive tests, and any concerns like that were hand-wringing, to say the least. Just to give you an idea of where we were at working at this time, the vaccination rates in our community as a whole were 38% the week before camp, and we're not going up at all. We are very much in a community that is resistant to the vaccination at that time, very cautious and concerned. And so we were right around 38%. And our rolling day, 7-day average of the COVID-19 tests. So it did go less than 250, exactly 2 weeks to the day before camp, which was the date that we set as our guideline. And then it stayed right around 250 to like 220 to 250, kind of bouncing in there during all 3 sessions of camp. And actually, that Tuesday of our last session of camp, it was still reporting at 249, 248. And they ended up doing a backlog that Saturday we got home. And during the week, it peaked to over 350. And so it has not been below, it's well above that level at this point, but has not been back into that range where we could have camp again. So we quite literally hit the sweet spot of when we could meet our numbers based on community spread for the 3 weeks that we were at camp. It was pretty amazing. And our 7-day average hovered right around 9.6 and was rising during and after camp, and has again exceeded the 10% that we had hoped for. Our numbers, just to again give you a comparison, we had 4 sessions, 3 weeks, 163 campers, 183 staff and volunteers. Our overall vaccination rate, thanks to Chris for all our pivot tables every day, was 86.3%. Our highest session was our teen-week session, and that was 96%. And that was out without a vaccine mandate. We didn't require them to do it, but we did end up getting up to those higher levels. And a few people who felt very strongly they would never get the vaccine actually did mention that our culture of kindness and safety that we talked about initially, that it was never, this debate or aggressive thing that we did, was in part the reason that they got the vaccine to protect the kids. So all of it, greater than 600 tests reviewed. We did have 5 positive tests pre-camp, 1 staff and 4 campers, and 0 positive tests of the about 50 that we ran during camp. And our results were, yay, 0 COVID cases. So pretty amazing. And we were pretty excited. And again, I reached out to staff and families for those 14 days after, making absolutely certain. And we did have several people have a few mild symptoms of a cold afterwards. They all went and got tested. Were actually only 3 of them went and got tested and were negative for COVID. And a lot of the families, as I see them in the hospital following up, were like, this was the first year that we didn't end up with some little mild cold or something, here and there. And so we eliminated not only COVID, but all of the infectious diseases that come with gathering in groups, which is just amazing and so exciting, and something that, we really celebrated. So lessons learned, we had a few. How to verify vaccination status and reach immunity goal was one of them. We asked the question, and I understand that some places you're not allowed to do that. And how do you reach the immunity goal? I think, again, is the supportive education environment, not any sort of high pressure, intense environment, that eventually you'll get to that immunity goal, and just setting it as an overall goal for the camp to keep everyone safe seems to work. You'll have increased needs for communication. So thinking about how to make sure people see what you need them to see I got a lot of feedback that the amount of email and information they had to process this year was very overwhelming to our staff. And so I always try to make sure if it was something where you're not coming to camp if you don't do this, it was very clear in the email headline so that they would address it. You also have to think about, does your staff, your volunteers, campers and their family, do they understand the risks involved in coming and the MPI? You know, a lot of times family would say, I know you're going to keep my kids safe, which makes me really proud that I'm part of an organization that we do such a good job of keeping their kids safe, and also stresses me that, you know, was like, do you understand the risk involved coming into that? Also, what does the testing requirement look like? What is the implication of a positive test for your kids? We had some that turned positive on that arrival test that we did. And, you know, how do you support those families through that? Because now they have to turn around and go back home with their kiddos who are not only sad that they don't get to come to camp, but also potentially going to be sick in the next few days. And then the workload and mental health for your medical providers and planning staff was a lot, like I said, for our program directors, for our executive, all of our team. It was a lot. And how do you make sure that you're taking care of their well-being and making sure that the workload is reasonable and kind of moving forward that way? The testing, I would just be really cautious with this. So I spent a ton of time. I had this whole thing set up with the Department of Health they had free testing with a QR code. You showed up and showed the QR code. It would load it into a database, send the results to me. It was super easy and free. And the only thing we really had to do was create a consent to release the results to camp, and that it would then impact their stay at camp if it was positive. And then 2 weeks before camp started, because the numbers were so low, which is really subjective, they closed so many of the testing center sites that the QR code no longer worked. And most of our campers did not have access to testing. So there was this last minute kind of frantic thing to try to figure out, how do we get the testing done and how do we still make sure this happens? And the magnitude of that work is not small. So take that into consideration. I'm happy to talk people through more details of that. But I do think, you know, if you can get a reasonable testing center that you pay to ship it to their homes, I would consider that. But budget is a big deal. And that was a huge thing for us because we had, I think our highest was 80,000 to 20,000 bids for testing, which is just massive. And depending on the size of your budget, maybe more than even what you can do. And so we did try really hard to just minimize the costs, and it worked out. We get everybody tested and everybody's safe, obviously, but it was a lot of work. And then the on-site testing I would do again. That was great. Our Department of Health provided it. They provided the people to do the work. They did really everything other than we did have to create the consent again to release the results to us, and that they would have to go home if they were positive. So not a lot of work for that piece of it. And that was something I would definitely ask your Department of Health about. Do they have any sort of school-related or kid-related activity programs like that? And then I think the biggest lesson learned was this. No matter what, you know, people were worried, but the magic of camp will always persist, even in the midst of a pandemic, even in the midst of masks and 100-something degree temperature and all of the massive amount of work that everyone has to do to keep these kiddos healthy and safe. It happens. And these are all pictures from this year with all of our cute little happy campers. And then here's some resources of what I used in order to create our policy, and then our page here. And let me show you. You just jump out and give you just a quick view of our policy. Let's see here. Here we go. New share. And then go ahead. I'm happy to answer any questions quickly. I know we're running short on time, but here's our policy here. And so it talks to you a little bit about our purpose, the statement, scope, what are prior to camp risk reduction strategies, our at camp risk reduction strategies, monitoring cohorts, all of these different pieces, and then our change to operations. How do we continually evaluate, cancel, and then a notification of cancellation of policies? So pretty thorough and detailed. And I see that my link worked, but has changed the layout of this. So it's kind of a little messed up that way, but that's all right. What questions do you guys have?
Jamie, Kel's, Winnie had asked a question about whether we didn't let people leave camp for supply runs to Walmart and other random things.
Yeah, that was a lesson we learned during ongoing. I would say I wouldn't. We did end up having people run in and just wear their masks and, distance and do their best. But then about halfway through, we started doing the pre-ordering pickup. And that's what I would recommend doing. We didn't, implement that immediately, but did once we realized that was really the better option, because the particular place that we had runs to get supplies was incredibly busy and nobody was wearing masks. So as soon as we recognized that, we changed course.
And then, oh, sorry.
I was just gonna say, yesterday somebody asked about if a camper's platelet count is below. Ours was below 100,000 or frequent nosebleeds, that they had to ask their oncologist if a nasal swab was appropriate. That was just a question that got asked yesterday.
And then Kel's asked me if our numbers were a mix of overnight and day camp. And I just wanted to, they were. Our day camp program before in BC years would be a 2-day thing where the day campers could come one day, then go home overnight and come back a second day. This year, we decided that because of the risk of people coming and going and disturbing our bubble, that the day camp would just be one day. So that was a program change.
Yeah.
Thanks.
Other questions?
I have a question. I see in the policy manual a little bit about the language used with staff around vaccines. Is that kind of what you all sent in the emails, to kind of encourage that but not require it?
Yes.
Okay.
Yes. This policy was sent out to everybody, and you had to read it and acknowledge that you read it. And then throughout some of our emails, we would cut and paste some of these areas and just say, as kind of a reminder, this is what's expected. And then right before camp, we sent out an email that was very brief bullet points. These are the things that are required, like the 2-week mark, so that like the latest you could do your immunizations, or the latest, that kind of information we sent out just the 2 weeks before, so that they could have it done before the 2 weeks before. So we tried to keep it pretty simple and just reiterate the wording that we used here in the document.
Hey, Jamie, we have another question from Jamie. She wants to know, how many overnight campers did you have per session? And was it the same as or fewer than your usual capacity?
It's less. I think we had 69 overnight for Kids Week. And how many was it for Teen Week, Chris? 70?
I want to say it was 78
or 9,
maybe.
Yeah.
Yeah. We drew little pictures of the cabins, and we did a lot of geometry to figure out like how far we could get people's heads apart, and then marked the bunks with removable tape when we were counting.
And we were very, very explicit in all of our rules.
I would say it's about 60, 2/3 of our usual capacity. And then Winnie asked a question about if we had immunocompromised patients at camp. I think she private messaged me rather than in the big message.
We did. Yes, we do. And we actually have and we didn't change this year. We have no restriction on an ANC. You can come with an ANC of 0, you just have to know. And so, yes, we definitely did have immunocompromised active treatment campers this year.
And then she also sent me, how did the adolescents take to the blanket barriers?
They were fine. Actually, I can't tell you guys enough how remarkable everybody was. Like how I thought there would be this endless complaining and endless, like, this is weird. And people were just so happy to be together. And the teens were the coolest. I'm sorry, there were so many just tears and of joy that they were back together. And for some of them, it was going to be their last year, or last year was their last year. We gave them an extension, and they were just over the moon about being together. They didn't care what I asked them to do. They just wanted to be together, and they did it. It was amazing, from 5 up to 19, and just did what they needed to do to be able to have that experience of camp and have the magic of camp be back. I think it was probably one of the most magical camps I've ever been a part of in my 20-something years. So it's pretty special. Plus, who doesn't want like a bunk that's a little cave? I mean, really, let's be real. It's cool.
I have another question really fast. Did you have a wait list or have to turn away? Okay, yes.
Yes, we did. It was hard. I think we ended up turning, I want to say like 15 to 20 away for Teen Week at least. I don't remember Kids Week waiting list.
Well, we did have a waiting list. The other thing we did is that we also ran a virtual camp session that we provided as an option. I think we had one, maybe two families that said, we don't want our kids to mask. We don't want to do this. So we will go the virtual session. We also had families that just said virtual session works better schedule wise. So that was a way that we could still serve some of those families that where we didn't have capacity at in person.
And that's also what we did with our positives for our kiddos that turned positive at camp, is that we immediately enrolled them in the virtual camp so that they could still participate and not just feel like, well, now what are we going to do?
Thank you so much, Jamie. Really appreciate it, especially since you kind of powered through your cold that you're having. We really appreciate it. So would encourage everybody to unmute your mics and show Jamie some love and appreciation.
Well, thank you very much. Now I'm in it. Thank you, everyone. Thank you so much.
Thanks, James.
Thanks, Chris.